I'm going to get us started. My name is Natalie Sampson. I am a co-lead for the Community Engagement Core within the M-LEEaD Center. So M-LEEaD stands for the Michigan Center on Life Stage Environmental Exposures and Disease. Those of you who know, it is a National Institute of Environmental Health Sciences core center, and it works to improve our understanding of the contribution of environmental exposures related to chronic diseases such as asthma, neurodegenerative diseases, metabolic syndrome, and prematurity. In particular, I want to highlight that this session is organized in alignment with the interests and the priorities of M-LEEaD's Stakeholder Advocacy Board, and we'll throw in the chat to you all who comprises that board of community and academic and leaders throughout Southeast Michigan. So in particular, today, we're going to talk about residents and researchers advancing environmental health and justice, a call for assessment and oversight of healthcare waste. Before we do that, I want to introduce three of my favorite people that I've gotten to work with in the last few years. So together on this Zoom, we have Omega Wilson. Omega and his life partner, Brenda Wilson, are co-founders of the West End Revitalization Association, which came to be in 1994 and became an official nonprofit the year later. Their mission is to support access to basic public health amenities, safe drinking water, sewer lines, housing, streets, sidewalks, things that we all want and need and deserve for the places where we live, work, pray, play. Omega has training and education in mass communications and journalism, but he is known nationally as an environmental justice leader that many of us look up to, with many awards for him and Brenda from EPA, from the North Carolina Environmental Justice Network, from the American Public Health Association, and the list goes on. We also have Vincent Martin. He is a community activist who has worked tirelessly for decades on local and national issues, the right to breathe. He spends a lot of his time collecting data, providing data, sharing resources, advocating on air quality issues for residents in Southwest Detroit, his childhood neighborhood. He represents in meetings with US EPA, US State Department, many other layers. He's also involved in many organizations, particularly Congress of Communities and the original United Citizens of Southwest Detroit. And he has been a go-to within Michigan and nationally as well on environmental issues. Last, we have Denise Patel. She is a relentless environmentalist and agent for change. Denise has spent her career working on issues to reduce toxic chemicals, advocate for anti-incineration, zero waste, fight climate change, you name it. She's also worked on a lot of campaigns related to environmental and occupational health with frontline communities, largely on the East Coast, but also globally through work with 350.org, the Divest Invest Network, Gaia, which is the Global Alliance for Incinerator Alternatives. And she has her master's in public health from Columbia. And we are just really lucky to have these three today. So the idea here is we're going to hand it over to Denise to give us a little bit of foundation on the complexities of our waste management in the United States. And then we'll spend some time hearing from Vincent and Omega about the experiences, and particularly how this has really come to the forefront during the early days and continues of the COVID pandemic. And then we really want to end with some action. What can we do? How do we have a call to action, whether that be locally or nationally? So we'll have a little bit of time at the end to talk with some Q&A, and we'll share a lot of resources with you all so we can do something about these issues. So Denise, I'm going to hand it over to you.
Great. Thank you. And thank you to University of Michigan for having us all here gathered today. I also am the chair of the Environmental Justice Committee at APHA, the American Public Health Association, which is actually where a lot of work, our small group here, our work originated. We're going to talk a little bit about what that work was and a policy statement that we had put together after, really communicating with folks on the ground who've been impacted by just COVID-19 waste and medical waste for a long time. But first, I just wanted to give you all an overview about how waste is managed, and specifically, we're going to talk about medical waste today. So waste, very broadly, is divided into two categories: hazardous and non-hazardous waste. Most of your household waste is non-industrial waste, stuff that's collected from offices and commercial sites, gets collected, sorted, and then sent to a landfill or incinerator. medical waste can actually be both hazardous and non-hazardous, as you could imagine. Hospitals and healthcare facilities collect types of waste that needs to be treated, or it could just be directly landfilled or incinerated. It could be sorted and reused and recycled, and we're going to get into a little bit of what those look like. But some of the things that we're going to talk about today include the hazardous waste and what happens to that. Sometimes it gets treated on site at a hospital. Some hospitals have little small incinerators on site. Some of them ship it off to places that can decontaminate the material and the waste, like a Stericycle site, which you're going to hear more about. And other places will just send it straight to a medical waste incinerator. The different types of medical waste, as you can imagine, include everything from body parts, human anatomical waste, equipment that might have blood or tissue on it, things that might be used in the microbiology and biotech labs that are on site at healthcare facilities. You've got your sharps, things like needles, syringes, scalpels, you get broken glass, and discarded medicines, and different types of drugs that are used or distributed offsite. So medical waste, you've probably, when you walked around your doctor's office or at a hospital, have noticed there's a bunch of different types of containers around to collect different types of waste. You got sharps, you have pharmaceutical collections. You might have heard about red bags. They have recycling containers, regular trash cans. This is the point where waste initially is segregated, is when it goes into those bins. And some departments will also collect specialized waste. So if you've got some areas of the hospital which are doing really specialized medicine might even have small amounts of radioactive waste. All of that waste that comes through the hospital is regulated by RCRA, which is the Resource Conservation and Recovery Act. That's the main federal law that actually regulates all waste across the U.S. This includes what happens to the pharmaceutical waste, which is collected on site. And then once that waste leaves the site, RCRA covers landfills and incinerators, like municipal solid waste incinerators, and then further regulates, those sites are further regulated under the Clean Air Act, depending on what types of emissions they have. So your incinerator, your municipal solid waste incinerator, which some hospital waste does go to, or your medical waste incinerators will be covered by the Clean Air Act. Really large landfills that give off lots of gases are also covered by the Clean Air Act. And then I just wanted to make a mention to folks who might be familiar with stories, depending how old you are. Back in the 70s and 80s, we were seeing a lot of medical waste that was being pushed up on shore. It was found along rivers. And that was because a lot of waste was just getting dumped into waterways and into the ocean. That kind of waste disposal got a lot of attention. And for a brief period of time, the federal government had a law called the Medical Waste Tracking Act of 1988. It was a framework that was used to specifically track what kind of waste was coming out of healthcare facilities, where was it going? And it was passed at the federal level. It was didn't receive the full commitment that we all think that it should have, because it also was given an expiration date. So 2 years after that act was passed, it actually expired. But in those 2 years, a number of states actually set up their own waste tracking, and they had there's a Michigan Medical Waste Tracking Act. A number of very proactive states had those laws on the books and continue to use them today. Before we jump into hearing about some specific case studies, I just wanted to highlight some of the impacts that we see from landfills and incinerators that handle medical waste. So you see a lot of air pollution from emissions that come out of the smokestacks at incinerators. If you're in the Detroit area, you might be familiar with the Detroit incinerator that shut down a few years ago. That was one of the two remaining municipal solid waste incinerators in the entire state. You'll have landfills where you see dust and debris blowing off site. I think Omega has some interesting stories about the landfill that they see in North Carolina frequently. But these sites are also sources of water pollution from the waste breaking down. It creates leachates that can actually, if a landfill is not properly lined, or if the lining breaks down after a number of decades, which happens to every landfill, the leachates can actually leach into the groundwater, or sometimes when it rains, run off the surface, depending on where and how those landfills are built. Communities that live near those sites will experience a lot of truck traffic and air pollution and noise associated with truck traffic. I mentioned the groundwater and contamination from leachates, but we also see some land contamination, foul odors, and all of these areas are just constant reminders of these waste sites and pollution being dumped in a community. There's been documented mental health impacts from just living near those sites and knowing that there's just all of this waste being dumped into your neighborhood and your community, and that has had real impacts on folks. And then for folks who may have the ability to move out or wanting to move out, really having to contend with the fact that those sites are close to their communities means they have lowered property values. There's a lot of industrial clustering that happens because they're seen as areas where, well, there's already an incinerator there. Let's add some more industry because it's an undesirable location. Meanwhile, there are communities that are left to contend with that. So those are just some of the overall impacts we see from the sites. I'm going to hand it over now. I'm going to talk to Omega from North Carolina, who's going to dig into a little bit more about what they're seeing on site and give us some of the history from there.
Good afternoon, everyone, and good morning to some of you too. Thanks a lot, Denise, and everyone who's on the panel with me. First of all, I'd just like to highlight how the policy statement originated. It originated because our organization, the Western Revitalization Association in Mebane, North Carolina, is a member of the National Environmental Justice Forum. And at the beginning of COVID-19, the issue came up about, of course, issues of hazardous waste and air pollution relative to incineration, as well as landfills, transportation, the movement of it, et cetera, and the workers who are involved, with the discussion that most of the sites where this stuff is disposed of is in Black and brown communities, and more Black and brown Latinx community people in low wealth white communities, workers were the ones who were disproportionately contracting COVID-19 and dying from it. As a result of that, a report was written for the Environmental Leadership Forum. It morphed into an 18-page document with dozens of people signing on and supporting it from across the country. It was reduced to a 2-page summary. It was submitted to a House Committee on Environmental Justice Issues in June of 2000, right? As a result of that, we were asked to present it by Charles Lee, EPA senior environmental justice leader, and at the environmental justice section of APHA. And as a result of that, a team of APH members and community members joined in to draft a policy statement over a period of about 18 months, right? What we were looking for, based on what we shared with the EPA and the Environmental Justice Leadership Forum, was policy, because it was very clear after communicating with congressional leaders that there was no formal policy. When we communicated with Senator Cory Booker's staff from New Jersey, they referred to as the wild, wild west of non-regulation. There's no basic regulations, and part of the reason for the lack of regulations of tracking and assessment and regulatory levels at the federal level was because it is not a political issue that one party can blame on the other. It's not a political football between Republican Party, Democratic Party, or independents. So nobody wanted to deal with it. And in fact, the adverse impact was the people of color. We have one of the largest stericycle incinerator facilities about 7 miles from where I'm sitting. We've recently had meetings with the governor's office, Governor Roy Cooper, out of the state of North Carolina, hopefully there's some people in North Carolina who are on our meeting today, and they can put their names in the chat. But we've been asked with the governor's office and some attorneys from the Southern Environmental Law Center, a major law center that deals with environmental issues up and down the coast, to address the lack of compliance. We know we need Stericycle to process and incinerate hazardous medical waste, but they need to be in compliance. The map you see on there is an area that shows the pollution stream based on air currents near Black and brown communities, and also the interstate highway where thousands of cars pass by per hour, absorbing the fumes in their cars, right? So we talked to the governor. We're in continuous conversation with the governor's staff relative to the Department of Environmental Quality, Department of Air Quality, that should address this and how to get the facility in compliance with the Clean Air Act and other acts related to how the waste is disposed of. It is an issue that needs to be addressed. We've already submitted letters and other communications directly to the governor's staff, asking them to formally recognize the policy statement so we can move forward in getting recognition in other states and getting recognition about how policies and regulations should be put forth to state legislatures and the United States government to deal with this, because of the life and death issue, especially when it comes to Black and brown communities. Thanks a lot. Look forward to any questions if we have time.
Vincent, we'll bring you into the conversation now. You want to share your role in all of this and the work you've been doing related to it.
Hello, everyone. First of all, you just heard my colleague Omega talk about all the great work that's going on in North Carolina. And I've been privy to be able to help participate in this endeavor. And one of my biggest concern is that in Michigan is now like the epicenter of land of waste. We get more waste than any other state in the country here in Michigan. And one of the issues is when COVID-19 came aboard, we was talking about medical waste and whether it was from the hospital, but things started being done at home. We started seeing all these things, and we were creating this waste by the metric tons. And one of my concerns was that this waste was falling into our municipal garbage stream. So it was being, it's actually, I consider it, a fugitive trash that's being leached into communities. And the way the system works, everything, like in Michigan, we have 8 landfills, 6 of them are in Wayne County, which is a issue. Now, Wayne County, if you know, is the largest BIPOC community in the state of Michigan. And the thing that I found, research on this information, that this has happened everywhere to communities of color. We host all these facilities, and we all have these same problems, and our numbers are the ones that keep increasing. When COVID hit, Wayne County got hit worse than any other county in the state of Michigan, with sicknesses, hospitalization, and deaths. We have some of the worst asthma rates in the state. We're looking at how it affects children in their cognitive learning, all those type of things. The growing industry in my community are dialysis centers. So that's a concern for me, for my community. And I'm hopefully that we have some Michigan government people here, because I want to encourage a conversation how we can start getting a grip on this management of trash in our community and how it's affecting us. We need to take a more thorough look at this. And now we're getting away from incineration, but now they're bringing online this hydrothermal liquefaction system that was denied in California because it's possibly worse than incineration. So, I mean, there's a lot of things to be concerned. And I'm really concerned because I've had two younger siblings that have died from exposure to chemicals in these communities that develop all kinds of diabetes and things of that nature. And I'm supposed to present next month to the National Ambient Air Quality Commission on these things. And my biggest concern is particulate matter and how it affects people with diabetes. So this trash, these emissions, all these things has a ramification on human survival, human body. So we need to take a very, very close look for it. So I'm imploring the state of Michigan to talk to us, because we've got plans on how to get resolutions on these problems. And I yield at that because I know I'm ready to get some questions.
Thanks, Vincent. I think we're going to kick it back to Denise to talk a little bit about action steps and things folks can do.
Yeah. So as Omega mentioned, the three of us were actually brought together, or four of us were brought together as we were working on a policy statement with the American Public Health Association. We're all members. And that's really where policy statements originate, where we see a problem that is a public health issue, and we really want the national organization to take a position on it. We actually do the research and draft and write a policy statement with recommendations for action. And we wanted to share those with all of you today, not just because we think it's a policy statement that can be replicated and passed with other types of health associations or the Medical Association, American Medical Association, or any other health professional group or professional group that you're affiliated with, but because we actually are recommending very specific actions that take place by the government at different levels. And so I just wanted to walk you through our core list of recommendations and then open it up for a Q&A. So starting out with the number one thing that needs to happen always when we're talking about waste is just waste reduction. We need to stop making the waste in the first place. Healthcare facilities themselves, if you work in one or you work in a lab, can really be thinking about procurement and how to reduce the amount of total waste that you're producing on site. We found through our research that one of the things that would really help and go a long way is education for better segregation. So only 15% of medical waste is actually hazardous, but as much as 90% is non-hazardous waste that just gets dumped in hazardous waste. And if you recall, what I mentioned happens to hazardous waste is that it almost always just gets incinerated because people think that it's contaminated, and the only way to kill off any of those contaminants, whether it be biological agents or chemical agents, is to burn it off. And that's a really harmful way to deal with waste. It creates lots of air pollutants, and we see a lot more plastic used in medical equipment, which when it burns produces things like PCBs, dioxins, and furans. So we really want to avoid that as much as possible. We need increased federal oversight, as Omega was mentioning, on healthcare waste. And what we actually need is new regulatory policy. I mentioned the Medical Waste Policy Act, and the fact that it has expired meant that there is a baseline of waste tracking that happens in some states, and some of them not really at all, because there's no federal requirement and the states didn't adopt any state plans. Some states where there was a lot of outrage and a lot of community activism actually have passed their own medical waste policies and continue to track it. And they continue to actually manage it specifically because the politicians there know that they're being held accountable by the communities and by the people. We also know that there's a straight regulatory line that could be followed, and the EPA should update model guidelines for state medical waste management. So for those states that may not actually have their own state laws, they do look at the guidelines often to understand what they should be doing. And so that's one of the things that also needs to be done. Just EPA could just update some of those model guidelines while we're waiting on Congress to act. And they can offer technical assistance and grant opportunities to fund programs. What should those programs look like? Well, it should include medical and health professionals and researchers. We need to include waste issues in healthcare worker training and education, as I mentioned in the first point. We need to conduct health impact assessments, cost benefit analyses, and economic research to really understand how we can be reducing waste, what their real impacts are out in the world. And we need to incorporate a model of restorative justice. Any and all research should take into consideration and consent of impacted communities. That doesn't just mean the folks who are receiving medical care. It really does include all of the communities that are like Omega's community and Vincent's communities, where people are impacted by all of this waste. And we need to prioritize federal funding to mitigate cumulative exposures and impacts, because as was mentioned, these waste sites where all of this medical waste goes are often cited, most often cited in Black and Brown communities and environmental justice communities. Those are communities that have faced decades and decades of pollution. And so not only are we talking about taking mitigation efforts with those communities, we also believe that federal funding should be prioritized for reparations for past harms and investments into those fence line communities. Those are all of the ideas that we had come up with when we passed the policy statement. They very much came from the communities that we were all speaking with that were working on the policy statement with us. But we can't all act alone. And so as a lifelong organizer, I just wanted to add in that every single one of you can be an advocate. You can provide testimony as an expert or even just a community member. You're an expert of your community. You can agitate for change and demand answers and call for action. And you can organize your workplace and your community. These are all things that you could take. And I think we have in the discussion some really great examples of ways that folks can get involved directly in Michigan, because I know there's a lot of folks from Michigan on the call and in North Carolina who are participating today. And I'm going to leave it to Omega and Vincent to actually talk about those.
I would like to thank you. I would like to take notice of quite a few people from North Carolina who have chimed in from the community level to the state level. First of all, Dr. Kim Getz from the North Carolina Department of Health and Human Services has chimed in. She is currently working with us to incorporate environmental justice in the county health assessment for all 100 counties in North Carolina, which would include identifying sites that create air, water, pollution. There's an adverse impact on people of color. Anne Marie Walton from North Carolina checked in and said that she's interested in doing a sign-on letter to further government action. Sylvia Ellington from Cone Health is a hospital network, and one of the hospitals are located here in Alamance County. We work together on the Health Equity Collective in Alamance County related to the environmental justice inclusion in this county health assessment. Io Wilson, who is one of our twin sons who work with us on clean energy and climate justice, also chimed in. The air quality and emissions from incinerators, it clearly is a climate justice issue. And Jason Turan, a new person I haven't met yet, from Person County, a couple of counties north of Alamance County, also chimed in. I just wanted to make sure we mention them for the record so it's recorded. So when we share this with the governor's office, other government officials will know several people from North Carolina are very interested and concerned about addressing this issue in our state. Thanks a lot.
Yes, and I also like to thank right now Dr. Stuart Batterman, Sung Kyung Park, because they was some, and Dr. Paul Mohai, because they gave us a lot of this research. They even started me on this journey in this environmental stewardship in our community. They gave us a lot of information to help us, fight back for our community. And I also want to send out a shout out and thanks for attending to Miss Marilyn Zepeda Salazar. She's from Chairman Rizalvo's office. You heard of the, EJ for All Act. She's very instrumental in getting that across the board. So, and we're doing a lot of, our time is limited. So one of my concerns is, we talked about Austin, but we even talk about biomass and fertilization, how a lot of this trash gets put into our fertilizer stream that's fertilizing our food that we're ingesting. I mean, we don't even know how it's going on. See, what's going on is deep science. You know, how are these things that are affecting us? You know, how is that affecting our DNA? How is it changing us? I mean, because right now, like I said before, particulate matter, we take it into our septum, it goes into our system, then it makes our pancreas produce insulin that's insufficient for us to fight, to fight, our high sugar and the fat burning. So it's other words having a metabolic change in our bodies. So we need outside insulin now for us, because that's one of my main concerns. We're getting sicker and sicker and sicker, and trash is growing and growing and growing. And where is this coming to? Communities like mine, communities like Omega's. So, and Omega haven't even talked about the incident, because big cities like New York City ship their trash to smaller communities, usually Black and brown communities. That's something that needs to be identified also. Is that, and we keep talking about equity, justice, diversity, and inclusion. Where's the diversity on trash being sent to Black communities nationally? The only thing that we're getting is sickness. I yield.
Thank you, Vincent, for sharing your experiences and perspectives. And I just want to recognize both folks on this panel, all the folks on this panel, but recognize the local, the state, the federal action that you've all been taking. And, that some of these solutions are happening at different levels and implicate medical school programs, implicate healthcare systems, implicate all levels of government. And so for us to be thinking about, where is our place to do the work? And if you're like Omega, he's in all of those spaces and doing the work. So if we can keep up with Omega. So there is a question coming in, and others, I'm encouraging you, we have a little bit of time here to have a bit of a dialogue, which is what we were hoping for. So Dr. Batterman asks, might we want to touch on concerns related to exports of healthcare waste to developing nations and occupational injustice? And I am looking at Denise. I'm looking at also, I see Eric, who was one of the co-authors of the policy statement, and I won't make him come off mute, but if he wants to, this was definitely something that got discussed in the group and didn't get enough attention in the policy statement. But if either of you want to comment or anybody wants to comment, please do.
I'll jump in first, and if Eric wants to join in, welcome to do so. So yeah, healthcare waste, along with all types of waste, is an increasing concern as it actually is exported. Folks who work on waste advocacy have coined a new term called waste colonialism, which is described as waste that is collected and that's produced and collected in high-income countries and then exported to low-income countries. And this does happen quite a bit, and it's been increasing over the past few decades. I think one of the examples where we've really seen a big pushback on this phenomenon is around e-waste. So you might have heard that a lot of, because we're producing a lot of electronics, and increasingly smaller and smaller devices where all the parts are glued together and you can't actually repair them. Those items get collected in e-waste programs all over the country, and then they get shipped off to Africa or Asia. It's a similar thing that we see with plastics. And so we're seeing that increasingly with plastics that are collected. So if you're even in a healthcare facility, and your waste is segregated and all that plastic gets collected, a lot of it, vast majority of it is not recyclable. In reality, only number 1 and number 2 plastics are actually recyclable. So all of the rest of it, you might be, putting it into a recycling container, but it ends up in either an incinerator or a landfill, or it gets bundled and shipped overseas. Where at one point there were some countries like China who created entire industries around managing plastic waste and then realized and recycling it. And they realized that so much of it is not recyclable that they actually banned the import of plastic waste. And that's a place where we saw a lot of global action, where entire countries across Asia were just banning the import of plastic waste. And they did that because it had real impacts on informal workers who really are the ones who pick through those dump sites and find the valuable waste versus the not valuable waste and try to use that to trade up or to sell in markets as their livelihood. And it's an inherently really dangerous place to be working. They're constantly exposed to chemicals, they're exposed to infectious diseases. There's high rates of hepatitis A and C in informal workers. And those are really prominent, especially in developing nations where a lot of this waste gets dumped.
Yeah, I'd like to quickly add also, I was asked to be a co-presenter for the American Bar Association. American Bar Association has a section that kind of parallels our environmental justice section with APHA. It's called the Environmental Justice and Civil Rights section. And that was a couple of years ago. And one of the things that we talked about is the disposal of this kinds of waste and other kinds of waste in areas where there's no major regulation. We have regulations based on clean air, safe drinking water, clean water, toxic substance, and solid waste, et cetera. The list is long. But we have a lot of agencies that do not regulate it. Then we have those who transport it from other states to Michigan, where Vincent is located, Natalie's located. And then we have other places that transports medicine pills by the barrels and burn it in North Carolina at the Stericycle place here in Alamance County to keep the price up, right? Actually, it's kind of unheard of. A lot of people don't realize that the waste is not always waste. Sometimes it's medical products that companies want to move in order to create a better market. So our site is one of those that burns pills by the barrelfuls, by the tonnage, okay? We also, at the American Bar Association presentation back here a couple of years ago, a little over 2 years ago, actually had some of the people on site. My picture is jumping, but you can still hear me. Had people on site who were talking about the disparity in the Caribbean and the islands, quote unquote, the islands that are the property of the United States, where the regulations are just almost non-existent, right? The Virgin Islands, Puerto Rico, Jamaica, other places. And it is a major issue when there are hurricanes and floods, then the waste, wherever it's placed, which is not under any kind of regulation, it winds up everywhere. It winds up back in the ocean. It winds up in people's yards. It winds up in their gardens. You wind up with hypodermic needles and all kinds of other physical waste where people live without very much regulation. So the challenge again is getting the agencies that produce it, like the ones in Alamance County and North Carolina and Michigan and New York and others, to control and track it. So you're not putting it on people who are not in a position to manage it and regulate it. And most of those countries where it's dumped are Black and brown countries in Africa and the Caribbean and Latin American countries. So that's something that we need to be very much concerned about, how we put upon other countries and other communities outside of, quote unquote, the 50 states. Thank you.
And Omega, and also the EPA, we put a lot of burden on the EPA, but this is also on the multiple agency, because we got the Department of Transportation that has guidance. We have the trains, that have guidance. We have all these different, and we keep going back to just the EPA. We need to take a whole of government approach on how we address this trash system, because of the Department of Agriculture, again, I just mentioned food being made, this trash makes up a lot of our fertilizer. And how, and then when we get something like COVID-19, the stress that puts on the system, you see the system is very, very fragile. So we need to sit down here and actually talk. The community has a lot of these answers, just to let you know. We got to give a little more respect to the genius in the neighborhood, because that's where answers are at. Because usually when we do research, where do we go to? We go to people in the community to get the data. And the data is then monetized and do everything. But then the solution, how do we get to action, is the big question that me and Omega is really fighting. We've served on we're on a lot of these calls because community voices are not at the table. Just to let you know why we participate so vigorously and how can we encourage this kind of activity, because me and Omega is just two people, but we need people on everybody's table. In the state of Michigan, we welcome the conversation. I yield.
Don't forget Denise and Natalie.
It takes a lot of people. Well, I'm not seeing more questions. I can keep this dialogue going, but I want to make sure folks know that they can throw questions in the chat. I know it's a really complicated issue, and it looks very different in some ways and very similar in some ways across communities. As we give folks a chance here in the last few minutes, I guess my question, Omega and Vincent and Denise as a lifelong organizer chime in too, but you're trying to navigate this in your state. Vincent, Omega, you've been really taking this to the governor's office and to, the state level. If you wouldn't mind, kind of, what is your advice for someone who's just kind of stepping into this work? They might be living it, they might be experiencing it, but how do they go about reaching decision makers, and what do they arm themselves with in terms of information?
I think one of the first steps is we have, I think, 3,900 counties in the United States. North Carolina has 100 of those, even number of 100, odd number of 100. We have 85 departments of health by county, because some of those counties serve more than one county in the mountainous area of North Carolina. Is contact the county health department. They're not far from where you live, and ask them if they have in their county health assessment that's required. The county health assessment is required to receive federal monies from HHS, Health and Human Services at the federal level, and ask them, do they have an assessment section specifically related to addressing the health inequities and disparities for people of color? Black, Indigenous, Latinx, Asian, and poor whites, right? And if they do not, you're going to formally, I'm not saying do this verbally, I'm saying do this in writing, right? And ask them to include that assessment. In our county, it's under the title of environmental justice. In your county, it could be Health and Human Services for people of color. In your county, it could be Health and Human Services of people of minorities, if you still like to use that language. But as it turned out, we got that as a request of a group of health professionals in our county who asked us to help them identify not only where environmental justice communities are, but what causes them to have more asthma, the more cancer, more diseases. What are the things that cause health disparities? Where are the environmental sites next to communities, within the communities, like lack of safe drinking water, lack of sewer infrastructure, lack of paved streets, landfills, et cetera. So as it turned out, our county is the first recorded in the state of North Carolina to do that. So our county has been asked to be an operating model with the help of Dr. Virginia Kidry, Joe Bowman, and Dr. Kim Getz, who's on the link with us today, on the participant today, to incorporate this in all counties. So if we're the first in Alamance, we're the first county, Alamance County, a very conservative county, still fighting over Confederate monuments to do this, then you need to ask in your state whether or not your county, using federal money, have ignored health disparities for people of color. It seems shocking in 2023 that that's the case. But this is a violation of constitutional law under Title VI of the Civil Rights Act. That's the first one where you live, in the county where you live. The second one is to send that information and that response or lack of response to your governor's office. Doesn't make any difference whether they're Republican or Democrat, and share that information with your state elected representative. I mean, that's 1, 2, 3. That's very close to you to get the ball rolling where you live and request a written response. Don't just look at it for them to ignore you. Ask for a written response and put your communication in writing so you can create your own file. That's my recommendation. Thanks.
And I think it's time that managed waste becomes a standardized procedure, because we got 50 states and we got 50 different criteria that needs to be followed. And but by all this waste being shipped to state, how do we assure that the criteria for this state falls in the same guidance with this state? That's an issue. And again, with lack of tracking, we don't know what's going on. So if the federal government need to get us grip on, because this is a multi-billion-dollar industry. Trash is a multi-billion-dollar industry. So they need to put some of them $1 billion that they're making to do the research to get this thing correct for the community. That's what's needed. I yield.
So you might have gotten the final word. Does anyone have anything else they want to say? We're about at time.
I just want to mention that we're having a meeting with the Alamance County Health Equity Collective. It's a group of about 35, 40 people who drafted the Alamance County health assessment that included environmental justice. We're having a meeting tomorrow about this. We're also having a meeting before that with a group of environmental justice leaders throughout the state of North Carolina, including attorneys, to talk about how this issue can be expanded in every county in the state of North Carolina. So we got this meeting today, and we have 2 meetings tomorrow, one at the county level and one at the state level, to address this issue. So thanks a lot, and we'll be glad to sharing this video with others as the time moves along, and we appreciate everybody being with us today.
Thank you, everyone. Thank you so much for those who joined. And you'll see a link there from Meredith about other videos that are on the M-LEEaD YouTube channel. Please do share this one out, and folks can contact this team and figure out what their next steps are in their state if that's of use. And yeah, thanks to these 3 for bringing their wisdom and expertise as organizers, as understanding the science and the policy. Thank you, everyone. Have a good day.